Hey, what's up everybody? This is Dr. Andrew Kim M.D. I'm a board certified psychiatrist, and today's video is called What is Suboxone and what is it used for? So this has been one of the most requested topics in recent months. People have been asking, I've heard about Suboxone and I want to know what kind of role can it play, whether it's for me or my loved one's opioid addiction. So I'm going to try to explain this in very easy to understand lingo and terminology so that everyone can have a good understanding of how this can be a useful tool for some people when it comes to opioid addiction recovery, okay? So let's jump right into it. So first of all, Suboxone is a prescription medication that is used in opioid addiction recovery, okay? So Suboxone is actually a combination of two medications. Number one, the first one is Buprenorphine. The second one is called naloxone. So it is a combo of Buprenorphine and naloxone, okay? So really the active and main ingredient, the important one we need to talk about is buprenorphine. Buprenorphine is a partial opioid agonist. For the sake of simplicity, it's a partial opioid. So what are full opioids? Okay, those are things like heroin, Vicodin, oxycodone, oxycontin, Norco. So when you take those kind of things, okay, they travel in your bloodstream, they go to your brain, and they activate things called opioid receptors. And that will reduce pain. But if you're misusing these things, you're also probably trying to get high. So you get a pleasurable rush or high, okay? So Suboxone, or the active ingredient, buprenorphine, is a partial opioid. So it travels in your blood, goes to your brain, activates those same receptors, but only partially, okay? And that's the key, partially. So it can produce some pain relief, but it really doesn't cause much of a high or that rush or pleasurable effect, okay? The other crucial thing when it comes to the science that you need to understand to make this make sense is the way that Suboxone or buprenorphine sticks to those receptors. Imagine a super strong magnet, okay? If this were the receptor and this is the Suboxone, all right? It sticks so strongly to that receptor, it makes it hard for other drugs, other opioids to activate those receptors. Okay, it won't let go basically is the best way to put it, and it makes it hard for the oxys and the heroines to activate that receptor. It's crucial to understand that point, okay? Now, the second ingredient, naloxone, is an opioid blocker. But you know what? I'm not going to waste time talking about it because in 99 out of 100 cases, it's useless, okay? What I mean by that is Suboxone is taken as a pill or a film strip that dissolves under your tongue. And when you do that, naloxone really isn't even absorbed. The blood levels aren't even significant. So it's basically a useless medication in Suboxone. The only purpose it serves is if people were to melt down Suboxone and try to shoot it up into their veins, it would block you from getting a high. But in reality, due to economics and human nature, people in America really don't do that for the most part, okay? So it's really buprenorphine that's the important ingredient. So moving on, now that you understand the science of how it works and some of its unique properties, in what ways is Suboxone used in opioid addiction recovery? Number one, it is used in the opioid detox setting, okay? I'm not going to go into a long description of opioid withdrawal. I did a whole video on that. It's on my channel. Go watch it. But if you have become dependent on opioids, your body has become dependent, and let's say you are dependent on a large amount, if you were to stop cold turkey, you would crash. The levels would crash. You're going from taking this much opioid a day, heroin, oxy, whatever, and you stop cold turkey, crashes, okay? It's terrible. It is super uncomfortable. People will describe it as a nightmare, hell, something they would not even wish on their enemies, and they're accurate. It's terrible, okay? So what happens if you experience that much discomfort? You run back to using your drug of choice, okay? It's a recipe for relapse. So in order to reduce the chances of that happening, we want people to get through detox successfully. So you can use Suboxone during the detox process. We try our best in some of the facilities, okay, in America, hospitals, psych units, detox facilities that use Suboxone. We try our best to estimate and match up the amount that would be needed to kind of match the amount of opioids used, all right? And then each day we control, as the doctors and nurse practitioners, we control how quickly or how slowly you go down. And we try to make that a gradual process instead of crashing, okay? And that's to basically up the chances that someone will complete the detox process successfully and to improve patient comfort during that process. So number 2, how is it used otherwise? So besides detox, it is also used in kind of the long-term management, or what we call opioid maintenance management, in addiction recovery. So what do I mean by that? So some people, when they finish the detox process, okay, they decide they don't want to be on any kind of opioid, and that's fine. Okay, that's ideal, really, right? They go see their psychiatrist to address other issues like anxiety, depression, insomnia. They talk to their therapist. They go to support groups, and hopefully they don't have too many relapses. That's great. Now, some other folks will, despite being motivated and using all these different resources, continue to have relapses. And they'll say, Dr. Kim, I'm tired of going to the emergency room, tired of going through detox over and over. It's this endless cycle, and I keep relapsing on my drug of choice. Okay? In these scenarios, it may make sense to say, look, you know what? Yes, you are going to be on an opioid technically, but it's a partial opioid. And you are better off being on maintenance treatment, at least for the near future, short term, to help you stay off your drug of choice, to increase the chances you're going to move further along in your recovery. And you're better off doing that and coming to the doctor's office to get a refill once a month and taking this daily versus going to the ER and detox facilities over and over and continuing this cycle. Okay? So how can Suboxone or buprenorphine help in this kind of maintenance treatment? Now let's go back to the science. This is why it was so important for you to pay attention to the science. So you already know now, because you watched this video, that it's a partial opioid and it sticks to those receptors strongly. And this is how it can help in maintenance treatment. Because you are taking a partial opioid, you're technically taking an opioid. So that can actually help reduce cravings and urges to go back to using your drug of choice. So it can help in that aspect. The other aspect is, let's say you have a relapse. Let's say you slip up and you go back to your oxycodone, your Norco. Remember that Suboxone and buprenorphine is sticking to that receptor so strongly, it is hard for the other opioids to do much of anything. So at the very least, patients who kind of go through that slip up or relapse while they're on buprenorphine will tell you they don't feel the full high. Typically it's just marginal, sometimes not even anything, because that buprenorphine or Suboxone is sticking to that receptor so strongly. So if that's the case, the hope is that person will say, well, I didn't even enjoy that. I didn't even get high. All right, it was pointless. I need to stop and think, I messed up. I got to kind of get back on that right path of recovery. Okay? So you're hoping that between those two things, reducing cravings and trying to limit the high or pleasure you would get if you had a relapse, those two things would help you stay on that path of recovery, okay, versus going back into that cycle of ER visits and detoxes, okay? So that's how the science of Suboxone or buprenorphine works. And by understanding that, you can now see how it can play a role in detox and kind of longer term maintenance treatment. Okay, I hope that makes sense. If you thought this was useful content, please like, please subscribe to my channel, please share this, okay? And please, in the comment sections, if there's other questions about Suboxone or buprenorphine you'd like to know, some more nuanced stuff, more details, let me know. I actually plan to do a couple more follow-up videos, things like why is it so hard to find a Suboxone prescriber, right? So ask the questions, let me know what else you would like to know about Suboxone. I'm happy to try to answer some of those. Until next time, this is Dr. Andrew Kim. I hope you guys are doing well. Please be safe. Please be well out there.